healthcare has become more integrated and technology-driven, the importance of documentation has grown. It bridges the gap between clinical operations and billing, ensures regulatory compliance, and enhances patient outcomes by providing clear and comprehensive patient histories. I'm so happy to be here again today. My name is Toni Appelberg-Parks, and I am a health administrator and clinical documentation integrity specialist from the United States. And this is the 5th module in our ongoing series of clinical documentation improvement or integrity. Just a quick legal disclaimer, this presentation is for informational purposes only and is not intended to provide and should not be relied on for legal, tax, accounting, or professional advice. The views expressed by the presenter are their own and do not necessarily represent the views of Innovation Plus Healthcare Consultancies. While every effort has been made to ensure the accuracy and completeness of the information provided, Appelberg and the presenter make no guarantees about the correctness and completeness of the content within this presentation. It is recommended that you consult a qualified professional advisor before acting upon any information presented here. No part of this presentation may be reproduced, distributed, or transmitted in any form or by any means, including photocopying, recording, or other electronic or mechanical method without prior written permission of the publisher. And now that that's out of the way, detailed documentation ensures that every facet of patient care is captured and billed correctly. It's not merely about recording patient interactions, it's about painting a full picture of a patient's health journey. This section of the presentation will outline the necessity of comprehensive records, which ensure that services are reported accurately and reimbursements are made properly. Comprehensive and accurate records in healthcare are critical for several key reasons. They ensure accurate reimbursements, accurate billing and reimbursement. Detailed documentation of services provided enables billing departments to accurately code each procedure, which directly impacts the reimbursement from insurance companies and other payers. This minimizes the chance of claim denials due to insufficient or unclear information. Proper documentation is required to comply with numerous healthcare regulations, including those set by HIPAA, CMS, and other regulatory bodies in the United States, and maybe some other legal compliance concerns in your own country. Comprehensive records help ensure that healthcare providers meet these legal requirements, protecting them from potential fines and legal issues. Then there's also quality of care. Detailed documentation contributes to the continuity of care by providing subsequent caregivers with a clear understanding of a patient's medical history, current condition, and the treatments they've received. This is crucial for making informed medical decisions and providing high-quality care, which we've talked about several times. And then audit trails are another one. Comprehensive records serve as an audit trail that details the care pathway of a patient. This is important not only for internal reviews and quality assurance processes, but also for external audits by regulatory agencies or insurance companies, as the case may be. They also facilitate research and quality improvement. Accurate and complete medical records are valuable resources for research and data analysis, contributing to clinical studies and quality improvement projects. They allow for detailed analysis of outcomes and practices, facilitating advancements in medical procedures and treatment protocols. And finally, patient trust and satisfaction. When patients are confident their health records are thorough and secure, it enhances their trust in the healthcare system. Comprehensive records ensure that all interactions and treatments are well documented, which can improve patient satisfaction by ensuring that their concerns are acknowledged and addressed properly. And I'm sorry, there is one more: operational efficiency. Well-maintained records can streamline various operational aspects of healthcare management. They help in coordinating care, managing schedules, and maintaining efficient communication across different departments. This efficiency reduces the risk of errors and increases the overall effectiveness of healthcare delivery. Comprehensive medical records are a cornerstone of modern healthcare, impacting almost every aspect of medical operations, from clinical decisions to billing and compliance with laws, ensuring that documentation is complete and accurate. And this is imperative for the functionality and integrity of healthcare institutions. There are some key documentation requirements essential for accurate procedure coding. Precise documentation directly supports correct coding, which is pivotal in minimizing errors and optimizing reimbursement. Some common pitfalls include vague or incomplete records, which lead to undercoding, overcoding, or even fraudulent claims. To counter these issues, it's crucial to employ strategies such as regular training sessions on the latest coding standards, using advanced coding tools that reduce human error, and maintaining a close collaboration between healthcare providers and coding professionals. But it's also important that humans do validate those coding tools, at least at this point. Studies have shown that improving documentation practices can reduce claim denials up to 30%, significantly impacting the financial health of medical practices. The integration of EHR's electronic health records into healthcare practices has revolutionized the way clinical documentation is created, managed, and maintained. So some techniques to streamline documentation processes include using EHRs, like the template-based documentation that's contained in some EHRs. EHRs often include customizable templates that guide healthcare providers through the documentation process. These templates ensure that all necessary information is captured systematically, reducing likelihood of omissions. Templates can also be specialty specific, ensuring that the pertinent information for particular types of care or conditions is gathered. Another is voice recognition, or NLP, natural language processing. Many of the EHR systems now incorporate voice recognition technology, which allows clinicians to dictate their notes, which are then transcribed automatically. This can speed up the documentation process and reduce the financial burden on providers. Transcription can be quite expensive. NLP technology can analyze unstructured data and help in structuring it, which improves data retrieval and reporting accuracy. Then there's real-time data entry. EHRs enable real-time data entry at the point of care. Clinicians can enter data during patient visits, which minimizes errors due to memory lapses. They're doing it immediately and ensures that records are updated instantaneously. This method enhances the accuracy of the records and helps in maintaining a comprehensive timeline of patient interactions. Next, there's integrated decision support systems. EHRs can integrate clinical decision support systems, otherwise known as CDSS, which provides alerts and reminders to clinicians based on the information into the system. This feature can prompt providers to perform specific screenings, follow up on abnormal results, or manage chronic conditions effectively. This can help with not only the patient care, but also quality scores. It ensures adherence to clinical guidelines and improves patient safety by reducing human errors. Integrating clinical documentation into medical staff workflows can be role-based access and input, such as designing EHR systems with role-based functionalities, which can help ensure that all healthcare team members contribute to the documentation process according to their own expertise and interactions with the patient. For example, nurses can input preliminary patient data. Physicians can then add diagnostic and treatment information, and administrative staff can update billing details. Also, mobile access and portability. Providing mobile access to EHRs allows healthcare providers to update patient records on the go. Whether they're moving between rooms in a hospital or conducting field visits, this flexibility can increase the timeliness and completeness of the records. Then there's training and support. Continuous training programs for all users of EHR systems are crucial to ensure that they are utilized effectively. Understanding the full capabilities of EHRs allows staff to use these tools to their full potential. Regular feedback loops between the IT department and medical staff can help identify pain points in the existing workflow and adapt the EHR functionalities accordingly. And finally, data analytics and feedback. Using data analytic tools in conjunction with EHRs can help identify patterns in data omission or errors, allowing for targeted improvements in the documentation process. Feedback mechanisms can also alert administrators to incomplete records, prompting immediate rectification. By leveraging these techniques, healthcare providers can significantly improve the accuracy, completeness, and efficiency of patient record documentation, which is fundamental for providing high-quality patient care and optimizing operational workflows. Okay, so some of what I'm going to talk about on this slide is a reiteration, but I think it's important to impress. Thorough documentation in healthcare is not only a procedural necessity, but also a fundamental aspect of compliance with coding and billing standards. It ensures adherence to regulations set by regulatory agencies. So let's delve deeper into how detailed documentation influences compliance and the potential repercussions of non-compliance. So how is it important? How is compliance important in healthcare documentation? Compliance with coding and billing guidelines is critical in the healthcare sector due to direct implications it has on patient care, reimbursement processes, and legal accountability. Regulatory bodies continuously update their guidelines to reflect changes in healthcare practices, technological advancements, and policy shifts. These guidelines are designed to ensure that billing is accurate, which helps in preventing fraud and maintaining the integrity of healthcare systems. So what is the role of documentation in ensuring compliance? Number one, accuracy in coding. Accurate documentation ensures that the medical codes used reflect the diagnosis and care provided. This is essential for billing purposes and for healthcare providers to receive appropriate compensation for their services. Inaccurate coding can lead to underbilling, which affects revenue, or overbilling, which can trigger audits and penalties. Number two, audit trails. Comprehensive documentation creates a clear audit trail that can be followed during an internal or external audit. Auditors look for discrepancies and errors in the medical records that might indicate fraudulent activities or errors in coding and billing. Well-kept records demonstrate diligence and adherence to required standards. Number three, legal and financial repercussions. In cases where healthcare entities are found non-compliant, they face significant legal and financial consequences. This can include fines, returns of payments, exclusion from federal health programs, and even criminal charges. Thorough documentation can often mitigate these risks by providing proof of compliance and intent. Number four, regulatory updates. Keeping up to date with the latest guidelines from regulatory bodies is crucial. For example, changes in ICD-10 codes or modifications in billing regulations need to be promptly integrated into the documentation practices. Regular training and updates for medical coding and documentation staff are essential to keep pace with these changes. What are the real-world consequences of non-compliance? Non-compliance can have serious implications for healthcare providers, including financial penalties, which are perhaps the most immediate consequence of non-compliance. For instance, inaccuracies in coding can lead to significant financial losses, either through denied claims or through penalties for overbilling. Audits and scrutiny. Healthcare providers that consistently show discrepancies in their documentation may be subject to increased scrutiny and audits by regulatory bodies. This not only strains resources, but can also damage the reputation of the provider. And most of all, legal actions. In severe cases, especially where fraud is suspected, legal actions can be taken against the entity or individuals responsible. This could result in criminal charges, civil suits, or both. Okay, so let's have a look at a case study so our case is about St. Helena General Hospital and their enhanced documentation practices. So St. Helena General Hospital is a medium-sized healthcare facility that faced challenges with a high rate of claim denials, which were primarily attributed to inadequate documentation of pre-existing conditions and the medical necessity of prescribed treatments. The hospital's revenue cycle was significantly impacted, creating financial strain and undermining the facility's operational efficiency. So the problem was that an internal audit revealed that many denied claims stem from poorly documented patient records, which failed to clearly justify medical decisions and treatment approaches. Critical information gaps included insufficient detail on pre-existing conditions, incomplete patient history, and a lack of rationale for choosing specific treatment protocols. So what did they do? Their intervention in response to these findings at St. Helena General Hospital is they undertook a comprehensive overhaul of the documentation processes. The key elements of this initiative included implementation of a comprehensive EHR system. The hospital upgraded to a more robust electronic health record system that featured enhanced capabilities for detailed note-taking and integrated decision support tools that prompted clinicians to enter specific details during patient encounters. They did training and development. All healthcare providers, including doctors, nurses, and support staff, underwent extensive training focused on the importance of complete and accurate documentation. Special attention was given to documenting pre-existing conditions and the medical rationale behind treatment choices. And then they followed up with regular audits and feedback. The hospital instituted regular audits of its patient records to ensure compliance with the new documentation standards. Feedback sessions were held monthly to discuss audit findings, allowing for continuous improvement and immediate correction of identified documentation deficiencies. They initiated collaboration between departments to foster a holistic approach to patient care documentation. The hospital encouraged collaboration between the different departments. For example, the coding team worked closely with medical staff to clarify any ambiguities in the records, ensuring that documentation accurately reflected the services rendered. So what were the results of all of these changes? Within a year of implementing these changes, St. Helena General Hospital saw a dramatic improvement in its claims approval rates. The rate of claims denials decreased by 40%, significantly enhancing the hospital's revenue flow. Additionally, the detailed documentation practices led to better patient outcomes, as the comprehensive records provided a more complete picture of the patient's medical history, contributing to more informed and effective care planning. So, what can we conclude from this? This example from St. Helena General Hospital demonstrates the profound impact that dedicated attention to documentation quality can have on a healthcare provider's operational success and compliance with regulatory standards. By adopting rigorous documentation practices, the hospital not only mitigated the financial risks associated with claims denials, but also improved its overall care delivery, proving that thorough documentation is a cornerstone of both compliance and quality in healthcare. So with that, just to conclude, the connection between detailed documentation and improved healthcare outcomes cannot be overstated. As we've explored today, effective documentation affects every aspect of healthcare, from clinical decisions to financial stability. It is imperative that healthcare organizations prioritize and continuously improve their documentation practices. We've examined a comprehensive exploration of the significance of thorough documentation in the healthcare sector, emphasizing its role in enhancing accuracy, compliance, and patient care by establishing the foundational role of detailed and accurate documentation. And it underscores how such documentation not only bridges the gap between clinical operations and billing, but also ensures regulatory compliance and enhances patient outcomes by providing a clear and comprehensive patient history. So with that, I'd like to thank you for your time and attention today, and encourage you to email me at the address on the slide or by leaving comments in the chat if you have any questions, comments, or anything you'd like to discuss. Thank you. Bye-bye.